Well, February is Heart Month, the perfect time to learn about all things heart-related. And did you know more than 5 million Americans are diagnosed with heart valve disease each year? Here to talk with us about heart valve disease is Dr. Noah Thormeyer, an interventional cardiologist with Mercy Health Physician Partners West Shore Cardiology. How are you doing today?
Doing well. How are you doing?
Wonderful. Thank you so much. So what exactly is structural heart and valve disease?
Structural heart and valve disease is a group of disease processes that affect the valvular structures inside the heart. The valves themselves can have problems opening or closing appropriately, and this can lead to abnormal blood flow throughout the heart and also throughout the blood vessels in the body.
So this is something people can be born with or develop later on, or how does that work?
Yeah, some of these are congenital, meaning patients are born with them, and some of these are things that they develop over their lifetime.
So treatment options, what's out there for this? What's the most common one, I guess?
The most common one we do is a procedure called Tavor.
Okay.
It's a very rapidly growing area in healthcare, but Tavor is definitely one of our more common procedures.
Sure. Explain exactly what that is.
Tavor stands for transcatheter aortic valve replacement. It's a minimally invasive procedure that we use to replace the aortic valve when it becomes severely stenosed or narrow. And it's an alternative treatment option that's in place of a possible surgical aortic valve replacement, which is much more invasive and involves a sternotomy and intrathoracic procedure.
Okay, we're going to look at some video on the screen right here. Can you explain a little bit about what this is?
This is showing the aortic valve when we're younger. It has less disease, less calcified and restriction of the leaflets, and as it becomes severe, you can see it becomes fibrosed and calcified, and it doesn't open as well as it should, and that leads to inadequate blood flow exiting the heart through the aortic valve.
Sure. And there's something out there also known as Watchman. What is that, and how does this all play into treating this?
Yeah, Watchman is a procedure that's designed to occlude the left atrial appendage, which is a structure inside of the heart. This is important because 90% of clots that cause strokes from non-valvular atrial fibrillation are formed in the appendage. So it blocks blood flow and helps prevent clots being formed there. This is a procedure that helps patients that are on blood thinning medications like warfarin safely get off those medications and still have a reduction in stroke risk.
So what are the benefits of doing this procedure?
The benefits of the Watchman procedure are that it's a safe alternative procedure to help decrease risk of stroke while stopping their blood thinning medications, which have their own side effects, especially warfarin.
So maybe people at home are listening right now and they know they have some heart issues and they actually need to start addressing them. I guess, how do they know if they're a candidate for this procedure?
Sure, yeah. Patients that would be candidates for the Watchman procedure are patients with non-valvular atrial fibrillation, patients that have other medical conditions that put them at a higher risk of stroke, and patients that are either on or are recommended to be on blood thinning medications like warfarin. People
always want to know when they can bounce back from something like this. How long does the procedure take, and I guess recovery?
Typical Watchman procedure takes about an hour, and patients are admitted on one day and they go home the next day.
Wow, that's phenomenal. Quite advanced. Thank you so much for stopping by and sharing your information.
No
and
problem.
To learn more about heart and vascular services at Mercy Health, visit mercyhealthheartandvascular.com.